picture comes and everything else should come into your memory. Like, what is happening, what do you see? So what do you see in the PDA? How I used to remember was the connection is between the P and D, pulmonary artery
aorta,
and hmm. So what happens
aorta,
is
arch of
exactly. So what is happening is over here, uh, there's failure of closure of the ductus arteriosus. So the ductus arteriosus doesn't close. Okay. So a lot of times what happens is when there's a premature infant or the infant is born to a mother who has had history of rubella during the first trimester of pregnancy, these defects can happen. And due to this, what will happen is the oxygenated blood will pass from the aorta to the pulmonary artery. Yeah, from the aorta to the pulmonary artery and mixes with the deoxygenated blood, which of course finally goes to the lungs. And then what is going to happen is the blood volume to the lungs will increase, due to which there will be congestion, isn't it? So the name itself is like clear, patent ductus arteriosus. So the ductus arteriosus didn't close, and the combination is happening between the aorta and the pulmonary artery. And what is happening is, because the blood is getting pumped at high pressure through the PDA, in fact, the lining of the pulmonary artery will be irritated and inflamed. And bacteria in the bloodstream can easily infect this injured area. That's why such patients will be predisposed for bacterial endocarditis. About the clinical manifestations, as I already said it to you, uh, they are pretty similar: shortness of breath, congested breathing, disinterest in feeding or tiring will be there. There will be poor weight gain, sweating will be there quite a lot, and tachypnea can happen. In fact, those patients will be having, and as you may also notice it over here, the weight gain will not be proper, the sweating will be happening, tachypnea or bounding pulse will be noticed for such kind of patients. So now, being clinicians, patient comes to you, they gave all that history. Now you have to auscultate using your favorite stats, right? Most of our healthcare professionals, including the doctors especially, they're proud of distinguishing themselves from the other healthcare professionals by carrying the stat. The stat is not for show. It is to help you in making your clinical diagnosis clear. So where do you auscultate the murmur? There's already a star, blue star for you. No one wants to take this blue star. So there will be what is called as continuous machinery murmur in the left intraclavicular region. So for the VSD, what was it? VSD was pansystolic murmur. ESD was wide and fixed split, right? And for the PDA is continuous machinery murmur, like this. And then for the management, how do you manage these kind of patients? What is a special drug which you have to give it for such patients? What is a prostaglandin inhibitor? That is endomethacin. Endomethacin can be given. It tends to work by stimulating the muscles inside the PDA to constrict, and that's why you may be able to close the connection. And of course, with that, you have to give digoxin, diuretics, nutrition, breast milk, a high calorie formula, sometimes nutritional supplements. And for the surgical management, as I said, it is, yeah, if the what is happening is that if the infant is younger than 6 months of age or who has large defects that is causing symptoms like poor weight gain or even rapid breathing as well, that should be considered. And in fact, nowadays we also have transcatheter coil closure closure of the PDA, or even the PDA ligation as well, which involves closing the open PDA with stitches